there. Your mouse is there now, so
Okay.
it, it gets printed single-sided this time. And with all of the edits kind of.
Be able to show up. 6 o'clock. Anyway. Yeah, this thing. Outside.
Yeah, the one farthest to the back is the one you want for the up-down thing.
So, we can actually open the meeting. First thing we have to do is approve the minutes, and Maxfield wasn't here last time anyway. We're recording, right? Yep. Okay. We'll open the meeting. Everybody get a chance to look at the minutes? Yes.
We like the video.
I looked at a few minutes ago. They look great. Good job, Tim.
Thank you. That's what I need. That's what I need to hear. Yeah.
It's really hard to screw up the planning commission meeting.
How'd that sound? It's been like more than 10 minutes.
Yeah, it's a BRB minutes on the other hand. It's a little more restrictions. I'm in charge of that.
Second.
I don't know as we have a first. So you wrote them. I guess I can move that we approve the minutes for a second.
I will second.
All in favor, say aye.
Aye.
Opposed, no. Maxfield. So I guess we'll open the meeting. The health and wellness section.
So this chapter was a lot of red text because it was kind of reformatted and shifted around a lot based on some of the feedback I got from you all in response to this draft Hyde Park chapter as like a template, and also some of the feedback from the Vermont Department of Health and Copperwood Valley. Allison might join if she has time. So one of Tim's comments was borrowing from the introduction of the Hyde Park chapter, so that was reformatted in a similar way, and these key areas of focus that are in bullet points on the page were used as the like format for the rest of the plan. So with Allison's guidance, the goals, policies, and actions were shifted around to follow those main headings and as well as the rest of the narrative in the chapter. So I guess I'll just pause there and see if you have any reactions or suggested changes to the edits I made in the introduction to the chapter, as well as the goals, policies, and recommendations, which I know you want it to be maybe more of a discussion presentation.
Being through it, it seemed good to me.
I didn't have any comments on it.
Yeah, I mean, all my feedback is kind of more specific and it's not related to the general approach, and I think the approach. Like that layout makes sense to me, and I don't know what else you'd have for what, you know what I mean, I'm trying to think like. I don't know what else, it seems more exhaustive, I did look at the one before, just because I was like, oh, man, there's something, I want to see what it was. It did seem a little outdated to my opinion, you know what I mean, and this seems much more of the times, so I thought. Yeah, that makes sense.
If there's any like specific, just starting on the second page, the overall goals, policies, and actions. Some of these were suggested additions from Allison, and some of these were just restructured from what you had there before, and I just wasn't sure if any of these didn't feel appropriate for town or might be something missing in here that you might like add.
I hate to say this, I said it before, but it's really big. So we think people will read it over.
The average person, no, they'll never read the town plan, any part of it. But the people that are, that you're trying to get grants from, well, you have it. For stuff like this, I believe, yeah. I mean, I hate to say it, but I'm not sure that federal grants are gonna be forthcoming on this with our, some of our language. But that's no reason to change it.
Yeah, no, it is what it is. If we chopped it in half without losing any significant meaning, would we do that? Would we do an executive summary of it? That's just really, really long. That's all. I know everybody kind of puts important things in it, so it's fine the way it is with me. I just, again, it's really long.
What would you chop out of it?
I wouldn't, personally, I wouldn't chop anything out of it. There's nothing in there that couldn't be reduced to at least half without losing any meaning. My opinion. So again, it's just one of those things just get so big. I wonder what audience we're shooting for. I know the Hyde Park version isn't as big. So maybe a better size for somebody to pick up and read, but maybe it isn't a small reader. Anyway, that's my only comment. I don't want to keep going on.
Jump right into the narrative instead of policies and goals. There are a couple of places I highlighted this to perhaps remove or change from the old chapter.
Right, there's a significant amount of this here, Bruce, that is crossed out and is coming out of there, right?
Yeah, and it does kind of expand because I track all the like changes that were made.
Right.
It will like boil down, but
Right, so if you look at page 82, there's like, you know, whole paragraph that's cross right out. Coming out.
Let's cross that on 82.
Well, the whole bottom section of it, the land use review, the nutrition, the transportation, that's all crossed out.
Right.
The very top part of it, the recreational facilities, because I assume it's mentioned elsewhere.
I mean, honestly, I'm spoiled by the fact, correct me if I'm wrong, Mike, that the important, this whole document could become half the size or less with tools, with automatic tools, and the meaning would still be there. So it's just my bias that you've seen the tools and what do you think, Mike?
I do think if you want public engagement, we are going to have to run it through something and do an executive summary of every chapter that is just a white paper, 2 pages or less. If you want the public to read it. I also worry, I mean, and this is my first time through one of these two, but I also worry that by cutting out some of the specific language and making things more vague, that we may make funding opportunities a little bit more difficult. I also think that, like we've gone through before with all the other chapters, all of the data and having all of the things called out so that nothing can be called into question. I mean, there is, I shouldn't say this in a recorded line here, but there is some power in having things that are long and difficult to read so that it allows us the ability to point to different things.
Could we do both if if it was an automatic
I don't see,
question, why wouldn't we do both?
I don't see anything wrong with taking the town plan at the end of it and pumping it through something
Okay,
and creating a, an abridged version that may be called out to different sections for specific things. It wouldn't be impossible to have it be its own tool in a way that you could ask it questions or something.
right.
Because public engagement is something that I think that a lot of small towns struggle with. I don't know that town plan is gonna draw them in, but it should be something that maybe we discuss at town meetings and things like that. Maybe it should have its own table.
Thanks.
Yeah, because no, to your point, this thing is massive. It's 3 reams of paper. But I don't know how to. I don't know how to reduce it without running a risk.
Yeah, I think you make some good points.
So there's 2 parts in the narrative, I guess I want to point to as places you may want to change or remove some information, I guess, starting on page 84. There were these like there's a bulleted list of areas identified as like essential to health and wellness, and also some potential metrics to measure Wolcott meeting that.
Are you asking in terms of updating the bullets or asking if there's validity to the, like, is this the same, like, if we were to try to measure it, what would the measurements be? But I'm curious if we use the proposed measurements, and if not, why would we need to list this?
Yeah. I mean, both of those things.
Yeah.
Do you want to keep these in here, and then do you want to create a baseline of data if you don't already have it to continue to measure those points by?
Like some of these just look hard to do. I'm thinking like that one in the purple that you have, like, I don't know if that's linking to the statistic, but I think we have that, how far people go to work, you know what I mean?
Mhm.
So I wonder if maybe we could just, like, if we were interested, what if we had data, like publicly available data points, if there were some like 2 or 3 years, I don't know. We want to keep the bullets, but I don't know. I'm just hesitant to like include potential measures if we're not gonna measure it. It could be anything, right? It could be like, good job.
values to either consider establishing a distinct committee to engage in like health and wellness topics in town, or make it a part of this group's like work. And having points like that to speak to for like town report updates, or just like any outreach you do, like to show the kinds of progress the town is making to meet health and wellness needs of people in town.
As opposed to like measuring the miles of trails, take that right out of there.
Well, if you kept it in here and wanted to start measuring it, like that might be the utility of having it. To like have something to like report out and share with folks and demonstrate kind of the town's commitment to that, if it's still important to you for the next years.
Some of these things would be hard to measure, you know, the number of Wolcott residents who bike or walk to work. Which month are we measuring? It's probably like 0 in December. Not many the rest of the year, because I mean, you have to go quite a ways to go to work.
Excuse me. That information is on the census website. So all those questions are still very valid, but they are here if you'd want them to be added. Just thought I'd add that.
Instead of just how many Wolcott residents bike or walk to work, could it be bike or walk to any destination? Because I know some people, you know, they might ride their bike to the town library or to, you know, somewhere else in town or somewhere else, especially on the rail trail. It may not be to work because they don't have time to do that, but on the weekends they choose to travel other than vehicular. That may not be as readily available, though.
Would be interested in us, in LCPC helping get some of those points to like make a little table and have this like be measurable. Or tell me that's something to consider.
It seems rather granular, like it's, you know, lots of pieces in here, but again, would it be served as well by, you know, some of these will happen, some of these won't happen. And would a more general statement or general points be a better thing than pointing out like just these individual fairly granular things that we could do?
More of like the list of things at the top of that paragraph,
Um,
under health and wellness issues, just like.
I don't know, it's just a vague idea that I would abstract it up a level to not to be too specific about exact things that you'd measure or say again, it's a minimalist kind of approach.
Some of these things that you're measuring, I don't really see where it connects to health and wellness at all. It may more connect to, I don't know, economic availability or, like I'm not riding a bicycle to work where I live, not regularly anyway. I'd be exhausted before I got there.
Put it into your truck, Jim?
I could put it in my truck. Yes.
No, I mean, how old is your truck? You may be bicycle after all.
My question is also like, this section's called health and wellness issues, but then like the first section, which has kind of like the abstracted ideas of what leads to health and wellness, is like, isn't it abstracted like, non-Wolcottized, I guess, like list of things that you would need as preconditions for health and wellness, I guess. Then the second one is like measures that we could use if we were trying to measure improvement. But like that improvement, like that thought has a cousin of like, what are we trying to improve, I guess? And I don't know if we want to do that because it's like temporal or whatever, and it could change. But it just seems like we're saying like, how are we going to fix, we have issues that we want to improve, but we don't know if I identify the issues. You know what I mean? I'm just not sure, like, then why are we even doing the measurement? You know what I mean? Like, I don't know, like, I don't know what the health issues are, I mean, I could guess, but like, you know what I mean? So I just don't know in terms of the section, like, I just don't know the utility of the list, other than like you were saying, if there was a planning committee. You know what I mean? That would be it. It's a non-exhaustive list, which means they could have other criteria they measure, so I don't know the benefit of this list of criteria.
I'd be happy to throw it into chat and just say, look, here's what we want out of it at a little bit higher level, maybe pick out some important points, but not go abstract. I'll send you that, but it really applies to most of the stuff here. You could pick out the important parts, but especially this one maybe.
I guess I just don't know what the section is doing, I guess, it's like. Yeah, it's full stop, that's my full question, like, what is the section doing?
Yeah.
I'm just not sure. I get it.
I don't know if this is an answer to the question, but if the question is, what is this section doing? If I read through the list on the top, it looks like most of the bullets below fall within one of those categories, whether directly or somewhat indirectly. The only one that I see maybe missing is the top one that says secure shelter, and it might be a good metric to know how many unhoused people, if any, reside in Wolcott. Or people experiencing housing insecurity. I'm not sure the proper term.
Is this section feeling like something that could at least be revised a bit more or removed entirely?
I hate to be the one to make that judgment, because a lot of these things just wouldn't apply to me or most of my neighbors, because we just live so far away from anything in the village, really. A lot of this is village centric.
Some additional like village engagement, trying to like send out a survey or talk to more people and, you know, on School Street or in the area about it.
I think it actually, you know, takes the village interest in pretty well right here. I don't have a problem with leaving it in.
Okay.
Personally.
Like for some of those, we could, LCPC could help put together some specific data points or just like baseline info with metrics.
The problem is we're not going to do any of these things, really. Do something about it, but
We're not gonna do any of these things.
we're not going to keep measuring all these things. Well,
We would know what the miles of trails in the town forest are. Should know that.
how long has it been in the town plan?
Town
Years.
forest, this is.
No, whatever, like individual measurements of
I
things.
have no idea.
Several years, I would guess.
Says
I don't
20.
know, again, it's just that, what's the right level to try to convince people to do something? And I hear you loud and clear that the objective of this isn't a plan. It's the town notions of what we should do. And that somebody will come along and make a plan. Somebody's an entrepreneur interested in developing the town. Or you will read this over and they'll make a plan and they'll make some kind of implementation.
Or they'll apply for a grant and use the plan.
Right. This is more of a predecessor to a plan than a sequence of actions that will get you to some kind of goal, which is what a plan is. It's just a general comment about town plans, I guess.
That's not what any of this town plan is,
I know.
or this one.
Apologize for being not that tolerant of the largeness of it.
If there is seriousness about measuring these bullets, I have a question about the first one, the miles of road in Wolcott that's sort of adequate for biking and walking. Would a dirt road with a 35-mile-an-hour speed limit be considered adequate? I mean, I know with a paved road, it's easy to measure the width of the shoulder, but when it comes to dirt, I mean, I see people probably walking more on the dirt roads and riding their bikes here than I do on Route 15. Is there some sort of what constitutes adequate?
That would be a real challenge to do, you know, unless you took into account traffic volumes. You know, a 2-lane dirt road that sees 30 cars a day, mostly between 7 in the morning, 7 and 9, and then again at 4 and 6. You know, you're gonna have plenty of room because you hardly ever meet a car side by side, whereas North Wolcott Road, same width, but you see a steady stream of traffic all day. I think in order to kind of quantify adequate, you need to take into account traffic volumes, and I don't think we have the traffic studies on all these roads.
Yeah, I would 100% agree. I mean, most of the time, the roads are probably adequate. I don't know if they're looking for, 80% of the daylight hours or.
Like standards for the paved roads, like you were saying, Maxfield, so we can look into see if there's actual standards for dirt roads.
Yeah, because I mean, I run and ride my bike on a lot of the dirt roads in town and, 99% of the time I feel totally safe.
Moving on from this section of page 85, you'll notice the first heading. It's restructured a bit to meet some of those initial overall key areas of focus from the introduction. And I added a brief description about the community forest. You'd like to review or comment or add anything to that. And a specific question about the athletic field down here. How it's managed and maintained currently.
We have a few committees, and actually it was the subject of last week, last select board meeting. About trying to consolidate in some way these committees, because there's the Parks Department, the Forest Department, the Athletic Association, the Recreation Committee. There's a bunch of different departments that are all kind of loosely managed. Specifically that field over there, it's a part of the regular municipal mowing plan. I know the highway department is involved in trying to help the parking area out, or was last year. Right now, the most involvement is coming from I want to say he is on the athletic steward something. I have no idea what his last name is.
It's the pickleball folks,
It's
isn't it?
pickleball, and his pickleball crew, they're kind of taking over down there, and they've applied for grants and different things. That's one of those things that might be kind of fluid for a little while, but I would say by the time this goes into print, we may have a little bit more structure. The other thing I noticed too, next paragraph, we may not have the ball field in North Wolcott. In the North Wolcott rec field.
Okay.
We are kind of crowdsourcing ideas on what to do with that, but I don't believe that we had talked about replacing the backstops or bleachers have been there in years, so. I don't think we were gonna replace the backstop.
And more sad news from the baseball front. I don't believe Wolcott Elementary has a baseball field. I believe they took out the backstop and now they have a giant leg breaker. I don't know if you've seen that thing. It's pretty sick. They have like a climate index on a baseball field. So that and dodgeball, that's the new thing. So.
I have it on good authority that there will be a new backstop down here though. Some flood resilient, fancy schmancy, does everything but your taxes backstop.
The first paragraph looks good. I would add that the Forest Stewardship Committee is also looking at community education events. Obviously, the school has their own plans too.
Last paragraph about the Wolcott Elementary School field, the last sentence of it in particular. That their status is questionable at this point due to issues with neighboring landowners. I think that was the landowners that we bought the town forest from. I'm assuming that's no longer an issue.
I go up there a ton with my kids, I've never heard, I read that as well. You know what I mean? What they're doing here.
The Act 250 permit didn't allow for the expanded use of those fields and the devils. They pushed the issue. Stop the use of them, but now we are the neighboring landowners, so. But I don't know about the Act 250 permit, if that had to be updated.
Yeah, I would agree, Jim. I think that issue's gone.
So it just has a soccer field now.
Yeah.
Okay.
The field, I don't know, it's fine.
There's a baseball field up there.
No, the backstop, it was like, I think it was a second. And so the dugouts, so I think they just figured like. If we do baseball at the field, and then we'll make. I have it, so.
The last section of that. Active living and transportation. is About the Royal Valley Rail Trail, on the top of page 86. And that, the LVRT is also brought up again. Yeah. Very bottom of 87 and the majority of page 88, and I guess. Just wanted to see if. That second section should migrate back here, or since the LVRT is also discussed at length in the transportation chapter, whether that whole long. Bit. You pared down or removed.
Yeah, I think the LVRT does belong in this chapter. I guess maybe some of the logistics about the maintenance and maybe even trailhead enhancement might be better used in the transportation section. I don't know if there's recreation specific grants where they want to see this language in this chapter, or if it's just in the town plan in general, it's applicable.
In the next section on health facilities, if you get down there, is it the Medical Center or Hospital of Vermont, or is it some UVM? I don't know what its official name is these days. Anybody know? Yeah. Not NCHB.
No, I don't think so.
Yes.
UVM, something or other, MHC.
Yeah, I should know this.
You should. Is it official that Copley is getting rid of their birthing center now or not? They're still fighting over
They're
it.
studying it,
Okay,
last I heard.
so we can still leave that in there.
Under community partners, can we add CAE and Hardwick? And at the top of page 88, the second paragraph, those, I think the three bridges referred to are probably the ones that have been replaced already. And the second bulleted point below that, the last sentence, it says there should be a sidewalk connection and additional signage between the LVRT and the town, school, and community forest. I think, we've looked at that a couple different times. I think a sidewalk in the traditional sense might be a stretch. Is there a better way to word that? Like safe connection or some, just due to the geography in that stretch, I think a sidewalk, plus most of it's dirt road anyway.
Right.
Yep, I think safe gets at the results of the walk on it from the fall of just signage, maybe lighting, changing like potential speed limits.
Maybe there should be an established safe connection and additional signage.
Should be able to take out the reference to composting toilets for the school street center. We aren't doing that anymore.
Agree.
Yeah. Thank
Jim,
you,
was that because
Sheldon.
when we talked about it, it was the cost, or it was because it's in a floodplain, or both?
It was the cost. And now that we've got the sewer system coming, that's kind of a moot issue.
Yeah, maybe I missed this. Are we going to be able? Are we going to be able to tie in a possible public restroom to the municipal sewer?
One of the things we discussed at a select board meeting was, during the install of the main lines, we want to have subs at every individual property, even those that don't have anything on them currently. For example, the Westover property will not exist. There won't be a home there, but we still want to put a stub off from the main outside of the highway envelope, the right of way. So that we could potentially do something like that. We haven't discussed how or where we would do it, but we would be able to, and the town is going to purchase not only reserve units, but also we're going to have our own user units, whatever they're called, for all these other buildings. So short answer, yes, we would have the potential.
So rather on the development of Fisher Bridge. Like that also mentions composting toilets. Maybe we should just generalize it as toilet facilities. Maybe composting is the best, but maybe just a portal that is works.
Moving on to the next section, is a new addition to the plan, but was something. And you brought up, add and, Allison from helping Mill Valley. Here, starting on the top of 89.
Do we change the wording on youth prevention? I mean, we're not trying to prevent youth from happening. I mean, it relates to the drugs, and it may be just fine, but
Youth substance use prevention.
yeah, yeah. Or,
Sounds like
Yeah.
sounds like a great idea. We sometimes actually use the word misuse, like youth substance misuse prevention. Could put it that way too. If I can add a word just to say hi to everyone. Allison Link from Healthy Lamoille Valley, program of the Lamoille Family Center. I worked with Val Balcor from the health department on some of these, additional pieces that the Hyde Park Planning Commission just approved, some similar language, different but similar. But I just wanted to say that in Wolcott, you all have, you're the first ones in the whole region who had a health and wellness chapter. So kudos for you. And all this is just over the past 7 years of my work building, and that it comes back to you to be able to figure out what the next level for Wolcott is really, I don't know, I'm just privileged to be part of it and to help support. So, and I didn't get to talk to all of you in advance, though I was at the select board meeting a couple of months ago and mentioned this to them. So I guess that's how it got over to you all. But, I just think anything that you're thinking about and your concerns or interests in health and wellness, also, of course, you're the residents of Wolcott. I live in Morristown. Like your interests and concerns should be in this chapter. And, this is based on, other experience in the region in Lamoille County and Lamoille Valley, the greater Hardwick area too. But, if you're seeing things that you don't want there, or you're not seeing things that you want there, you can also, like, I'm happy to help support that for like the next version. So just keep that in mind. Thanks.
There's no other questions or comments on that section, this last like overall heading. Beach-friendly environments, healthy homes and food access is. The overall key focus areas of intro and. Some of the original content added a few additional things from the last plan.
Yeah, they're also like policy, their goals, policy recommendations, other resources that are pretty amazing that the Two Rivers Ottaquechee Planning Commission put out for their local towns, that we've been using some other resources too. So try to embed them within. But anyone who's really interested in this, they show like all health and wellness related language for each town municipal plan chapter, but then also, to really designate and highlight health and wellness for like a health and wellness chapter. And they also recommend that you can do it in both, because when referring to a chapter, sometimes you want to refer to the health and wellness chapter, but maybe someone's in land use and there's something relevant there that they're not going to get to the health and wellness chapter. So they were seeing that, to obviously be concise, but also to be able to, that it's okay to have it in a couple of places or reference other chapters. And there are lots of different types of policy recommendations or ideas that can be put in, or actions.
Like, from the age-friendly environments and the childcare facilities, I just like the chart or the table, the like maps, the criteria. I don't know, I was having a hard time with those percentages and thinking they like align with what I think anecdotally is like going on with populations, just in terms of how many kids are like in kindergarten, it's like 5. So it's just not. So I was just thinking, like, if we have less people than other towns and our increase, like our rate of children is higher than theirs, but we still have like materially less children, there's less of a need for daycare. So I just didn't follow that argument of like, if we have a higher percentage of the population as kids, therefore there should be more childcare. And then it also extrapolates to like in the region, but we have childcare in the region, just not in the town. So I was like, I just don't know what this paragraph in the charts are adding that's not included in the first paragraph, just saying like, hey, we don't have any daycares. There are some, the only thing I was gonna add this, and you don't have to, is like there are, like my kid goes more, so, you know what I mean? So there's like, because it seems like an exhaustive list, but it's not exhaustive in terms of the surrounding communities. But like, I understand that the intent of the first paragraph is like, here's sort of the childcare picture. The second one is, hey, here's some resources that exist to help people out. But the third one, I just didn't.
Yeah,
I didn't-
totally. Yeah, Val and I worked on that a bit, and I think some other, some other folks in like looking at the whole region. And obviously, it's coming from like template material. If you think it's less, realistic for Wolcott specifically, like it has to be, Wolcott residents saying, hey, this is important in our community, but also knowing that it's hard to get into a daycare these days, and so maybe it's looking like towards the future and, what you want recommendations to be into the future. And maybe, people from Morristown will come to Wolcott for our childcare, or, it's serving the residents. But, I think it's all of the language, everything in there, and any recommendation is all up to you and Wolcott constituents and residents. So take it for what it is and make sense of it for what you want, and then say, hey, is this relevant or not? And what parts of it might we keep, and what parts do we need to explore more? And if you want to put something back on me to explore, I'm happy to, like with data or whatnot. I think Tori can like keep track of that for me, and I can help work on any pieces of this that you're interested in learning more about.
This chart, unless you're familiar with the shapes of towns, it's kind of. I mean, I can pick out Wolcott here only because I know what the shape of the town two towns away is.
It looked like Nebraska. I mean, now that I look at it, it's already it's Nebraska, it's really Nebraska.
It took me a minute to figure it out. But maybe it's labeling on it or something.
Yeah.
I don't know.
Or just take it out if it's not making a point.
Yeah, that's the point.
Yeah, for sure. I think Val added that and added some of the other graphics too for the Hyde Park Town Plan, and she was also on that Town Planning Commission. So, I think based on the rest of what you're doing and what makes sense, and just making sure, it's not just taking up space, that it has a meaningful purpose in the town plan is, I think, most important. Or it doesn't. So then, you know what I mean? I guess I'm most interested because I didn't get to meet with you all before Tori asked for my support last week. And, you know, I asked the select board for anything, topics related to health and wellness, or, substance misuse, mental health, all the different areas of wellness, physical, nutrition, like all different areas. But I didn't get to talk to all of you. So it really, if there are areas of wellness that you see not represented here, that you think, oh, this is like our town's health and wellness chapter, it needs to be here, then, please like speak up and just kind of look at it as a whole, because I think there's a lot of opportunity to like maybe make some things more concise, but also maybe some things are missing.
On the second bullet point under school activities, where it says education and healthy habits, comma, and can we add healthy diet? I know they had Katie Black was in there a couple years ago and did some great nutrition workshops for the students.
That's a
And
great
then
idea. Yeah.
and in the paragraph below that, I guess by definition, the school doesn't really have a garden. They do have a garden space. But maybe we could add in there, they do have garden days in the spring and the fall, I think, where
Mm-hmm.
they set it up. I think a grade or two at a time goes out there and works in the garden. So it might be good to mention that in that paragraph. That is at least happening. And Reeve from CAE comes over and helps the students with that.
Oh, that's so great, that connection. I wanted to add that, Wolcott has been connected to the 3450 initiative from the health department over the years and has received some mini grants from Healthy Lamoille Valley, and there still are more. That actually relates to the 3450 that is a little bit embedded there in chronic disease, because there are three behaviors that lead to 4 chronic diseases that lead to more than 50% of deaths in Vermont and more in Lamoille County. So that's lack of physical activity, poor nutrition, and tobacco use. Now we know that like alcohol also leads to chronic disease, and it was just a tobacco prevention initiative. So that's kind of why. But like when towns, different municipalities or faith-based institutions or schools or organizations, businesses can become 3450 partners and just work on these goals. So, we tried to highlight that a bit through here, and Wolcott actually got some prevention sponsorship 3450 funds for the Wolcott Community Garden a couple of years ago. And then also got some funds for the pickleball recently, and like we've worked on some signage in different areas, and there's also prevention sponsorships that are available currently that Wolcott can apply for that I mentioned to the select board. So, there's just different opportunities, but I just want to mention those 3 behaviors around wellness, that's why that whole piece on chronic disease is there. And looking at if we all are engaged in working on, these 3 behaviors, then we can reduce chronic disease in our area. Just a little background on that.
The school too, I was just saying, like, they do additional stuff. I made a list here, like they were in WCAX for PBIS, like it's like a positive behavioral interventions and support. And I know they also do this thing like every other Monday called Eco, where the kids go out for like 3 hours in the morning every day, or every other week. And they also have the winter activity, and they also have her name's Mrs. Dearborn, but she is the Moyle County Mental Health Services school-based clinician. So in addition to a guidance counselor, they have a mental health clinician at the school. So I just want to add that because they've done the food part, but they actually have done a lot for behavioral things with kids. So that's what I would say.
That's great. Tori, are you getting these additions? Because I didn't hear every single one. Okay, awesome. Thank you.
It's the one in between the PBIS and the.
Oh, like the Ego, like they just have an outdoor education program that takes for all grades every Monday, every other Monday, for like a few hours where they go in the woods, have like a tree and stuff. That sounds cool. Like, all right.
Yeah. And if there are also specific people in town, I mean, you mentioned Katie Black, and I know her well, like there are lots of people Jess doesn't work in, there are people who don't who live in Wolcott who are, who are working in Morristown or other schools, but like if specifically for Wolcott, like, or to ask Katie to review this chapter, like, or to kind of check out, I'm sure she would be, or I don't want to say I'm sure, she might be very interested, or some other people to say, hey, we're really working on building up, evolving this chapter from what it was. And I mentioned it, I was at the legislative breakfast this morning, and I mentioned it to Dan Noyes, who was actually part of writing the initial chapter. So he's really excited to hear that it was evolving in this next iteration and really growing. So I wonder, like, with all of our collective minds, and especially Wolcott residents and leaders who, I don't know all the people you do, who are really invested in health and wellness, and how to, involve them in the process. If you're open to that at this point, or at some point to review it, they might have other additions.
There was also a question about whether the school had a farm to school program.
Yeah. I know their chef was on WCX as well. There's like a direct connect to WCX, but.
I mean, now that we're on it, I'm very active in youth sports, and Healthy in Loyal Valley has actually a youth sports coaching collaborative that we're building, and a handbook that is being adapted and updated right now. And I'm been engaged with folks from Wolcott for a lot of years in youth sports, and I don't recall that that's being mentioned at this point anywhere. And maybe I'll offer my just point to, if you're interested in including youth sports or other types of activities, pottery. I mean, there are a lot of different resources in town for even after school activities, what we call out of school time, that might be included. It just depends on how much more information you want in there.
Anything else to add for the last page of this? It's kind of one of Allison's points earlier. There's this last little bit on land use decisions, and we could call out health and wellness more specifically in some of the upcoming chapters too.
Story, I don't know if in the end, the final version, had some of those like specific policy recommendations about, mental health, substance misuse, prevention, recovery, treatment or not. But some of the ones that Hyde Park pulled in, around some buffer zones, around some like recommendations on local conditions, or just like looking into it, looking at there's a variety of topics that could be in recommendations on that, education, make sure resources related to all different kinds of resources, mental health, substance use, recovery are like promoted through the town. Anyway, Hyde Park did a bunch of things like that. That I don't know if there's that short list in the document that you all are looking at, or if Tori can share that with the group.
Well, the updated chapter does have
Oh, it does. Okay, great.
specific headings for the substance prevention, treatment, recovery, and mental health. And I did print out the Hyde Park draft chapter in case you wanted to also just flip through here and see if there's any specific ones you want to just confirm or add it into Wolcott's plan.
Yeah, there are quite a few. I'm not looking at it in front of me at the moment, but if you all have it, there are quite a few that you might think about considering, just as recommendations, to consider when making decisions about town policy around these topics, into the future. Also, if any of you have like specific policy recommendations that, there are lots of draft language and sample language, tons of it, but, ideas for what you'd like to see as some recommendations around any of these topics. Again, for anyone interested, there's the resources I provided with Tori and Jim, I think has seen them. And I wonder, the other ones from Two Rivers, Ottaquiche and other places. It's a really nice grid that actually shows you lots of language in current town plans across the state. And it's also separated by like goals, actions, recommendations for each town chapter. It's really quite a great resource.
One of the things it's probably in the transportation chapter, what would be in terms of incentivizing, non-motorized travel to and from places in town would be to put an EV bike charging station possibly at the school and at the town office, somewhere in that vicinity. I guess it's one of those topics that straddles both of those categories.
Yeah, that's it.
Another question I had is like way up on page 82. There's the last bullet on social inclusion, engagement, and sense of community. So support the inclusion of public health experts, people with lived experience, benefit practice, all municipal and regional boards and work groups where policy decisions are being made. And I think that's almost the exact same as the last bullet on access to healthcare and health equity. But one of them adds whenever possible, and the other one doesn't have that caveat. I was just wondering if they're both the same, can like that be subbed out and not duplicative somewhere else where it applies to all if possible?
You're a good
Maybe
editor.
Yeah, that would be, they could just be taken out and put it overall.
Yeah, because I think that's the intent. I'm sorry.
What are we talking about when we speak of people with lived experiences?
Oh, that's a great question. That's a term used, and you can change that language. That came up, like the health department uses that language. But often when we look at data, or sometimes when we're around the room, we're talking about things, but that this concept came out of the disabilities movement of like nothing about us without us. So always including people with lived experience, who have when making decisions or making policy recommendations about certain demographic of people, of including them in the process. So it's just another way of saying that. And so you can definitely change the language to, to make it more, reader friendly or less jargon, but that's a term used also of people with lived experience. I don't know if that answers the question, but that's what it's intended to mean.
Makes sense.
Yeah, but it's not often clear. So, maybe it does need some clarification of, people with lived experience related to the topic on the agenda or the policy recommendations, like, including people in the process with who have lived experience, maybe need some more words.
Questions, comments, additions? With the reboot of this chapter?
Okay.
Take this feedback and make some edits. I'll share that with you next time and also start the natural resource chapter updates.
Natural resources next week or next month.
Yeah.
I should say. Okay. When you, when you edit the chapter, do you just absolutely remove the crossed out portions, or is that always gonna be in there till the end? I just want Bruce to have like half as many pages.
I could like.
It's so small, I can't see it anyway.
It's not easy to know what's being changed, but I could do like a, this is edited and also just like a clean one for you to look at, if that would be.
Can we remove it if we're in Word or something? Can we take those out? If you send me a copy of it, can I just clean it up?
Accept changes.
If I accept it, then it'll just disappear. Okay.
Just want to be transparent with what's happening.
AI might have a problem.
Saves paper. Yeah, that's a good question. What will happen with the crossed out? Yeah. Check it out. Yeah, probably total confusion.
I'd like to thank you for coming to our
Yeah.
meeting tonight, Allison, giving us your input, your work on the chapter. It's greatly appreciated.
Yeah, pleasure. Thanks so much for working on this. I mean, it is you all, as I said, who, when I first came here, I was doing an analysis of all of the municipal plans. Wolcott was the only one with a health and wellness chapter. So I always mention it when I go places and I'm talking to other municipalities, use some of the language that you already had in the plan or in some of our resources that, quote the Wolcott Municipal Plan, and looking forward to just helping go beyond the plan, right? Like that's what it's all about, making these recommendations to, for the benefit of for our towns in our area and for your town. So thank you all. And feel free to reach out anytime, Allison at healthythemoilevalley.org. And got a lot of stuff going on. Happy to meet with folks to share more. But yeah, kudos to you. I'm happy to come on again. Tori, we can be in touch, and anyone else who wants to reach out, happy to connect.
Thanks.
All right, so does anybody else have any other business they want to bring up? I guess we can close the meeting. Stop recording.